A CT scan of your chest gives you about 7 millisieverts of radiation. A chest X-ray gives you 0.07 millisieverts. So yes, that is 100 times more. But here is the question nobody asks. What does 7 millisieverts actually do to your body?
Every single year, you receive about 2 to 3 millisieverts of radiation just from the world around you. From cosmic rays, from the ground beneath your feet, from the food you eat, from the air. That is before you have had a single medical scan. So a CT scan adds the equivalent of 2 to 3 years of normal life, not a nuclear disaster. 2 to 3 years of Tuesday.
Ionizing radiation works by knocking electrons out of atoms. When it passes through your body, it deposits energy along its path. This energy can break chemical bonds, including the bonds inside your DNA. That tube spins around you up to 3 full rotations per second. On the opposite side, a row of detectors catches every X-ray that makes it through. More X-rays get through soft tissue, fewer get through bone. The detector measures these differences from hundreds of angles. A computer takes all those measurements and solves a massive mathematical puzzle. It reconstructs a cross-sectional image of your body, a slice. Stack enough slices together, and you get a complete 3D map of your insides. Doctors can see tumors, blood clots, fractures, and internal bleeding that no other test can find this fast. That's why 90 million CT scans happen every year in the US alone.
Scientists use a model called linear no threshold. It assumes that any dose of radiation, no matter how small, carries some risk. At 7 millisieverts, that translates to roughly a 1 in 2,000 increase in lifetime cancer risk. Your baseline risk of getting cancer in your lifetime is about 1 in 3. The CT scan moves that to about 1 in 2,000 higher.
For comparison, smoking 1 cigarette per day for a year increases your cancer risk by 1 in 200. Living in Denver, Colorado, higher altitude, more cosmic radiation, adds a similar risk per year. That 1 in 2,000 number is not nothing, but it is genuinely small.
And here is what the 1 in 2,000 number never includes: the risk of not having the scan, a missed cancer, an undetected blood clot, an aortic aneurysm found too late. Doctors order CT scans because the information they provide outweighs the radiation cost. That calculation has been done. It is not reckless. A CT scanner is a rotating X-ray system. The gantry, that large ring you slide into, contains an X-ray tube and a detector array on opposite sides. It rotates around you continuously, taking roughly 1,000 to 2,000 individual X-ray projections from different angles.
Each projection is a 2-dimensional shadow of your body from one angle. The computer uses a mathematical process called the radon transform and filtered back projection. It reconstructs a complete 3-dimensional map of your internal anatomy from all those shadows.
Modern CT scanners have dramatically reduced dose through 2 technologies. Tube current modulation. The machine automatically reduces X-ray intensity where tissue is thinner. Iterative reconstruction. Instead of simple back projection, it uses repeated mathematical estimation to produce sharper images with less radiation. The dose from a modern CT scan is significantly lower than it was just 10 years ago.
Should you be concerned about CT scans? Honestly, almost never. If your doctor has ordered one, the clinical benefit almost certainly outweighs the radiation risk. Children are more sensitive to radiation than adults, so pediatric CT protocols use lower doses, and CT scans should not be done unnecessarily. If there is an equally effective non-radiation option, use it.
The problem is, we built that model using data from atomic bomb survivors in Hiroshima and Nagasaki. Those people received massive doses, hundreds of times more than a CT scan. We then drew a straight line from those high doses all the way down to CT level doses and assumed the relationship holds. But at low doses, the data gets noisy. Some studies suggest tiny amounts of radiation might actually trigger your repair systems to work harder, a concept called hormesis. Others say any dose is harmful. Decades of research, and we still can't settle it. A CT scan can find a blood clot in your lung in seconds. It can detect a ruptured appendix before it becomes sepsis. It can spot a brain bleed while there's still time to stop it.
In trauma, CT is the single most important tool for deciding whether someone needs surgery right now. Every year, CT scans prevent an estimated 80,000 deaths in the U.S. alone.
Medicine is always a trade-off. A CT scan has a theoretical 1 in 2,000 risk of causing cancer decades from now. But the condition your doctor is looking for might have a 1 in 10 chance of killing you today. When a doctor orders a CT, they've already done the math. The scan saves more than it risks, every single time. That said, not every CT is necessary. Ask your doctor 2 questions. Is there a non-radiation alternative, like an MRI or ultrasound? And what will this scan change about my treatment? If the answer to both is clear, the scan is worth it. So, are CT scans dangerous? A CT scan is not harmless, but it's not the monster the internet makes it out to be either. It's a tool that gives your doctor the ability to see inside you without cutting you open. That ability has saved more lives than almost any other invention in modern medicine.
The most dangerous CT scan is the one you needed but were too afraid to get.
The most dangerous CT scan is the one you needed but were too afraid to get. If you learned something, hit subscribe. Physics of Medicine.